Hey, hey, welcome in. Let the good vibes all begin. Something good is about to happen. Sure. I've been waiting on you. Got a seat with your name. Started with a coffee chat. Now we about to change the game. You got a story worth telling, and I got a room full of ears. So drop whatever you've been holding. Get ready because your time is here. Because when real people talk to real people, something shifts. When real stories meet real listeners, something lifts. Every Saturday we show up and we bring our best. Show up to Carrie Connects and leave it best. Show up, show up. Something is happening here. Carrie Connects, Carrie Connects. This is your moment, come near. Where every story intersects and every heart connects. From a coffee chat to the main stage, just bring who you are. Carrie Connects, Carrie Connects. Connection is the start. Carrie Connects. Entrepreneurs, voices, friends, where inspiration never ends. You did not come this far just to sit in the back. Everything you walk through was getting you ready for that. So step into the light. Let somebody see your face. Because the right conversation can change everything in this place. When real people talk to real people, something shifts. And real stories meet real listeners, something lifts. Every Saturday we show up and we bring our best. Show up to Carrie Connects and leave it bright. Show up, show up. Something is happening here. Carrie Connects, Carrie Connects. This is your moment, come near. Where every story intersects and every heart connects. So the coffee chat to the main stage, just bring who you are. Carrie Connects, Carrie Connects. Connection is the start. We started over coffee just to see if it was real. Yeah, you opened up and showed me everything you feel. Now the world is watching and they say the very best chance. Carrie Connects is where somebody finally cares. Show up, something is happening here. Carrie Connects, Carrie Connects. Listen, you know it, come near. Every story intersects and every heart connects. From the coffee chat to the main stage, just be who you are. Carrie Connects. Real conversations, real connections. This is Carrie Connects. Show up.
Hey, 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 welcome, welcome, welcome. We are super excited that you all have joined us once again on Carrie Connects with my special guest, Mark. How are you? We're going to be talking about thriving under pressure, and I'm so glad that you are here today. So we're going to pick up where we left off on May 9th, but I want to go someplace new. But before we get started, for those who are new to you, go ahead and just introduce yourself and say hi.
Hello, everyone. How are you? My name again is Mark Brezzell. I am a former cardiovascular perfusionist by training. I graduated from Johns Hopkins a few years ago. I spent roughly around 30 years, 10 years in cardiac surgery as a cardiovascular perfusionist, and 20 plus years working within medical affairs within different organizations, different therapeutic focuses. And after about this time frame, I felt a call to action to step out and be more about advocacy, about helping people preserve their health, because most people, we that the end game is productivity, but they don't recognize that that end game is impacted by
Mm-hmm.
your wellness structure. And so, if you're not well, you can't reach that finish line, or if you do reach it, then you're dealing with multiplicity of consequences.
Yeah, we definitely don't want to be in a situation where we are dealing with multiple consequences. So, before we really get into what happened when you left the stage the last time, I want to remind our audience that they can drop questions on Facebook, LinkedIn, or YouTube. Those are the places where we can see you live. So, you might be watching from Substack or you might be watching from Instagram, but we can see the questions live on these three platforms. And I also want to take a few minutes to say hello to a few people who are in the audience that have joined us. And so, first and foremost, if I can scroll through the sections properly, I have to say hello to Marilyn Clark. I want to thank you for being here. Let us know where you are visiting from, and also let us know what the weather is today. Somebody told me today that their weather is in the 3 digits, and so we don't quite have that problem yet in the Midwest. But make sure you drop that in the comment section and connect with Marilyn. She is absolutely phenomenal. Love what she's doing in the industry in terms of supporting organizations. So make sure that you connect with her. And of course, my Besties Beyond Borders business partner visiting from Vancouver, Canada. So make sure that you connect with Layla as well. And now I have Miss Simone. I'm not sure if this is my sorority sister or not, but she said, come on, theme song, period. I did that. I wrote the theme song myself, and I'm super excited about that. And then Mr. Savor the Flavor himself, Kenneth Dunner Jr., who is joining us from Texas. I finally showed up for my own show, right? That's exactly how it goes. You have to show up for yourself. And I'm not sure who Kenny Mafia is, but thank you for being here on LinkedIn. And we want to thank David for being here. He's saying hello from the United Kingdom. So we are international. And then we have Christy visiting us from Florida. So you all continue to drop your comments, your questions. We have Nicole joining us. Nicole, let us know what city and state you're in and what the weather is. And Miss Simone says, we're excited to have you during Male Mental Health Month. And that's exactly what this conversation is about. Hey, Linda, happy Sunday to you as well. Let us know where you are. And oh, this is my sorority sister because she is in Las Vegas, Nevada, 95 degrees. That is hilarious, right? And so we have a LinkedIn user joining us from Seattle. Let us know who you are. And Linda is in Ontario, Canada. She says it's rainy and windy. So again, continue to drop your questions, continue to drop your comments so that we can make sure that you are a part of the conversation when we go to our audience Q&A section. So, when you left this stage the last time, which was May 9th, was there anything in that conversation that you kind of wish you had more time to talk about? Because I know I had a lot more questions.
Well, I think for me, the only thing that I really want to expound on more is kind of having a better understanding of the connection between stress and performance, or output. Many times, again, when they think of stress, the first thing that comes to mind is my mental capacity is depreciated, or I'm fatigued, or I just can't. But what they did not don't understand is all of the the physiologic components of that. Your judgment is impacted, your cognitive abilities are impacted, your sleep is impacted, your judgment,
Mm,
your metabolism, your cardiovascular health is, all these things are impacted. And so many times when we think of stress, we always think of it more of a mental malaise. But no,
mm-hmm,
there's direct physical manifestations of connectivity with this thing. And that's something I want to kind of help people understand, that basically, high blood pressure and diabetes and burnout, anxiety, all this stuff is engaged when you're dealing with long-term stress. And so I want people to truly understand the biology of stress, and how that impacts your leadership, how that impacts your interactive wherever you may be, whether it's at work, whether it's even within your home setting, because many times people bring their stuff home. And a lot of
Absolutely.
times you work so hard during the day and you wonder why you don't have time to be able, or your capacity has been so reduced when you get home around family and you crashed, or you're just tired, or mentally you're just not where you want to be. So just helping them understand that everything is congruent, everything is homogenous, everything is, they all work together.
And I think you're absolutely right. I'm hearing an echo on my end, so I'm not sure what that is about. But I do think that you're
Am I
absolutely
echoing?
no.
Okay.
We're good. We had this problem last time,
All
y'all, so
right.
we're trying to keep it together this time. So, but what I love is that you talked about how everything is interrelated, because a lot of times when people are dealing with stress, they don't realize that not only does it show up in your body, but it also shows up in your personality. It shows up in the workplace. It can show up at home.
Mhm.
And this is Men's Mental Health Awareness Month, but that physical stress
Mhm.
shows up. Also, it shows up mentally. So when we're mentally stressed, it shows up in our body. When it shows up in our body, a lot of times we get aggravated, we get agitated,
Very
and we
irritable.
do things that are kind of outside of the norm because we're
Absolutely.
dealing with so many issues. So, has anything shifted or changed since the last time you were here in how you're talking about your work or the people that you're talking to?
Now, I think probably the biggest shift, and really, I won't call it a shift. It's more
Okay.
of it's more of a continuation of my message. It's just, again, heightening the. See, when you initially talk to people about wellness, they have a kind of a misunderstanding of what wellness entails, but they don't really understand that for you to be at peak efficiency, at peak performance, your body has to be at peak efficiency and peak performance. It's not like they're two separate entities. Well, I plan on doing this today. I plan on doing that today. But if you didn't get enough rest, if you our mind is boggled down by multiplicity of various things, or if you didn't really have enough time, if you're not eating well, and so your diet is very poor, because you're more focused on eating, you're packing in foods that may be highly processed, or you're not eating enough of the good stuff. You're not providing the necessary fuel that your body needs to operate on. That will impact you. That impact your bottom line. And I think that's where, from an organizational standpoint, when you're talking about productivity, you talk about leadership, retention, that sort of thing, these are the type of things that you have to look at. You can't just look at the benign wellness. Okay, go drink some water and sit in the corner. No, this for you to be productive, you have to really make sure that your body is in a state of resiliency,
Mm.
and feed it, rest it. All these things are necessary for you to be able to survive in such a very high, thriving and very intense environments that we're living in today.
Absolutely. I definitely understand that. And a lot of people miss out on your body. Would you say that your body recovers when you're resting? Talk a little bit more about that resiliency.
Absolutely, absolutely. Resiliency. The major recovery period is during rest. That's what rest is there for. Many people, they forsake that because they want to keep pushing on the front end. But when you don't get enough rest on the back end, then the machinery that you need to be able to push on the front end starts to go off the rails a little bit. And we don't recognize that. For example, I know that many times when we talk about addiction, some of the addiction sciences that exist out there, one of the problems that they deal with is that they're, because of the drugs that they may be taking, certain biochemicals are thrown off, and your body is not producing the various endorphins, the various chemicals that help to demute, let's say, everyday processes. When your joints and ligaments, all movement and just all that generates, the body is homogeneous, so it handles that with ease. But when you start knocking things off, where levels are starting to drop, And now people are starting to feel, you can feel your muscles contract. You can feel impulses. You can feel stuff that makes you feel not so good, because normally your body will, has processes that negate all that. But when you start knocking things off kilter, then now things that are normal start to have abnormal effects. And that's why people get so sick, is because now that they fit, all these levels are so low that everything hurts. Contracting muscle, you turn your head and your eyes, just these are muscle movements that are normally, don't have a problem. But when you start messing around with your body chemistry and you start feeling things you don't normally feel, it's very disheartening, and people can get extremely sick as a result of that. So I'm just using that as an example, but it kind of culminates and surmises a lot of the stuff from, generally speaking.
Absolutely. And I love that you talked about that, because so many people have normalized feeling abnormal. I've heard so many people say this, and I've seen so many videos on social media where they're kind of joking about what happens when you're in your 30s, when you're in your 40s, your 50s, and beyond. And they have the videos where you stand up and, just like you said, your neck hurts or your knee hurts, or they're holding their back as they stand up. And so all of those things don't have to be a part of your normal day-to-day existence.
Absolutely.
But we've normalized the abnormal. Now, I know last time you were here, you talked about introducing this blood conservation technology at Toledo Hospital. And that has some techniques that allowed Jehovah's Witness patients to have successful surgeries without blood transfusions. Mm-hmm. Now, that is mind-blowing to me, because my godmother and some other people in my life are Jehovah's Witnesses. How are you able to do that? Now, walk us through what that work taught you, really just about adaptability in human beings, and how you bring that into your wellness practice.
Well, we had a surgeon there who really was big, and he had done some training in ways of kind of mitigating utilization of blood. The biggest thing is that one of my mentors, his name is Dr. Ari Shander. I give him a shout out. Of course, not listening, but he basically, we call him the godfather of blood conservation. He was in his 70s and 80s. In his early practice, he was the one who sounded alarm on the utilization, the overutilization of blood. And basically, he was the one that demonstrated data. He's global KOL, but he demonstrated data that showed that that giving extraneous blood is almost like giving an organ transplant. Your body reacts to these foreign substances, and so your body, as a result of that, it can impact mortality. And he was the first to show that. And over time, now you need blood. If you particularly there's elements for that. But what I'm saying is, his thing was not so much giving blood. His thing was giving overuse of blood. We have to develop ways where we able to compensate without causing such a rush or such a negative impact by the body's immune system. And that's where he started developing ways of cutting back on the utilization of blood and using other means, whether it's drugs or just reduced volume. All of these ways of trying to compensate. So the need for extra blood transfusion becomes less and less and less. And then, of course, when with that, the subset of patients that don't really want any blood transfusion, which were Jehovah's Witness, he worked with them, and we developed techniques that they were satisfied with from their religious standpoint. And we were able to not give them, we and the whole paradigm from when they first came in to when they leave, we were very tight on the amount of fluid that we gave them. We kept their drugs, we kept their pressures at certain levels. So we were able to put them through this procedure without having to give them any blood. They were we call them tight, but we kept them dry, which means that we didn't give them a lot of extra fluids. We could control their pressures pharmacologically versus giving them a lot of extra fluid to boost their pressure back up. So I'm just saying there's little things that we can do. Now, what amazed me about the adaptability is I don't remember, in the 10 years I was in practice, I don't remember a patient that we utilized this technique, and they needed the blood. Most of them flew off of bypass. Most of them were extremely well. It was very labor intensive from the clinician standpoint of having to compensate and bypass, because it's a lot easier if the pressure drops is to give them fluid and give them a little extra fluid or but it's just amazing how adaptable the body is. That when we did this, it was very intense, but these people rarely were their chromatic rates or were very low. These people came out with excellent levels, and their recovery was always very, very, very good. And so that taught me. Now during it, I didn't pay a lot of attention to it, but after the fact, I realized, wow, that's really incredible how adaptable the body is, and how it compensates. It's almost like if we did everybody this way, which would have been very labor intensive, but it just goes to show you that they were not at any risk. Even those that were hemorrhaging, there still was ways that you can kind of manage it. You can, what they call it, filtrate, where you can take the fluid and you kind of concentrate it down, increase the hemolytic rate. I mean, there's a lot of little things that we were able to do where we can keep them from getting a blood transfusion.
And I absolutely love that about science and about the human body and our resiliency. I think it's absolutely amazing because sometimes people avoid going to the doctor because they aren't sure of the type of treatment that they're going to get, whether it's religious, whether it's socioeconomic. And so I love that there are opportunities for people to still get the treatment that they need and still be treated
Absolutely.
with the respect that they deserve.
Absolutely.
And just speaking about respect, I know that you do some work in some diabetes advocacy work. You do that in Africa and you do that in India, where there are definitely cultural differences. But most people don't even know that diabetes is a global crisis. What would you say you're seeing in those communities? Maybe people aren't talking about it, but they should be talking about.
A lot of the problems in those communities are access. There's a lot of disparities there. Access. That, for example, it's evolving in particularly some of the African nations where they're having more exposure to what they call, glucose, monitoring, basically blood sugar monitoring equipment. Where now, before it's always a finger stick to test your blood sugar, but now they have these various devices that actually can do continuous monitoring of your blood sugar, and that helps kind of give you a better gauge of how you're able to manage your diabetes. So that's kind of a big area right now. A lot of countries don't have access to those CGMs, we call them. So there's efforts now where in laws to kind of open up the door for other countries, for the companies to be able to bring their technologies there, and make that available to them. You still have some countries that needles is a struggle. Various needle types where utilizing that for administration of diabetes. And then, of course, you hear all of these new technologies that are coming out. A lot of places don't have access to insulin pumps if they want to use an insulin pump. So that's something that still is a big issue. Some they don't have access to those types of things. So they're doing everything kind of the old-fashioned way, which is not necessarily a bad thing, but it does improve their quality of life, and they're able to manage their conditions much better. So there's a lot of little things like that, and then of course there's a lot of legislative type of challenges, that there's always a big fight, where they're trying to make sure that that they have that they're not being taken advantage of, that they have the open access to all different types of therapies, and so those are some of the big areas. But yes, this is a global crisis, in China, in Africa, and India. I mean, these are some, this is huge. This is a global issue. It doesn't matter who you are. Doesn't matter where you come from. Doesn't matter your age. People are susceptible to diabetes, and which is interesting because in the past, one moniker was, people would have what they call adult onset, or actually that's the onset now, but they used to call it juvenile diabetes, because most kids that had type 1 diabetes were born with type 1 diabetes, or they're born
Wow.
or presented very early on in their youth. Now they've added the adult onset, because as adults you can get diabetes, particularly type 1. It can happen all the way up, all through your years. It doesn't really matter whether you're 10, whether you're 25, or whether you're 50. You become a diabetic, and type 1 diabetes presentation is quick. It's a matter of months where it manifests itself. Whereas type 2 takes, it can take years, before you get to a point where you start having symptomology.
So I have a question.
Yes.
I'm curious because I see a lot of people, whether it's type 1 or type 2 diabetes, I see a lot of people who feel like because they're skinny, that they are not going to be able to get diabetes. And so I know that it is related in some ways to weight, but I just want to kind of clear up that myth or that misconception that as long as my weight is a certain point that I'm never going to be able to get diabetes.
No, you could be 110 pounds and have diabetes. It doesn't.
Mhm.
It's not based on your weight. Whether a lot of the one thing about weight in relationship to diabetes is many times when people have extra fat and extra adipose tissue, a lot of times you have a higher source of inflammation, and that can contribute to the diabetes etiology in and of itself. But
Mm.
that's why if you have type 2 and they recommend lose some weight, then that reduces that inflammation load that's exhibited, and so a lot of people are able to control their sugars. But no, there's a relationship, but they're not
Mhm.
totally they're not totally antagonistic. Is basically you could be thin and still have diabetes because of the underlying origin of what is diabetes. Basically, is your pancreas operating properly? If it's not running
Mm.
properly, then that's where the diabetes comes from. Either the there's various cells of the pancreas are releasing enough oxygen, or are is the body uptake of actually not oxygen, insulin, or
Mm.
is the body's uptake of insulin adequate? So it's a combination of whether you're releasing insulin. Sometimes people have normal levels of insulin production, but the tissues aren't absorbing the insulin like they should. So the
Mm.
sugar, and the sugar is not being absorbed properly. So that's where you still have elevated blood sugar. So you think about an elevated blood sugar. Basically, the sugar normally the body will drive the sugar into the cells, and that's what the insulin helps facilitate. And so
Okay.
when you don't have enough insulin, then this less of the sugar is able to go into the cells, and the cells need it for energy. That's why
Right.
people lose weight. It's because there's there's a little mismatch that's going on, and so you can think of it in two ways. Either the body is producing enough insulin, but the glucose, but somehow the uptake of that insulin is less than should be. So that will keep your blood sugar high because now less sugar is still going into the cells. Or the exact opposite, your body is not producing enough,
Mm.
which is now also. So you have two different two different causes, but the same effect. Your blood sugar is still elevated.
Okay, I appreciate that clarification. And the second clarification I want to make is sometimes people think, well, I'll just stop eating cookies, cakes, donuts, and then I'm not going to get diabetes. Or if I just eat one cupcake or one donut a week or a month, then I'm not going to get diabetes. So I'm glad that you clarified the way that it works inside of the body. It has to do
And it
with
does help. Yes, it does
yes.
help. If you don't eat a lot, see the problem with all that stuff, particularly highly processed foods, it does cause a spike in your blood sugars.
Mhm. Mhm.
Normally when you eat fruits and vegetables, your blood sugar rises at a much lower trajectory. It takes and your body's able to manage it. But when you're eating strip sugars. I kind of like in candies and in foods that are high in, with the corn syrup, the high glucose, high fructose corn syrup, and all
Fructose.
that kind of
Mhm.
stuff. Basically, what's happening is that now your sugar's spiking, and when you eat foods that constantly spikes your sugar, your pancreas is now trying to compensate for that, and so over time spike, spike, spike. And then every time there's a spike, your pancreas is reacting. So it's what reaction, counter reaction, reaction, counter reaction. And over
Mm.
time, that starts to wear out your pancreas so when you eat foods that don't cause that, your pancreas is not as working as hard as when you're just eating food that's just drives your sugar up through the roof, and then your body has to now work hard to kind of get back down. The difference between white sugar versus cane sugar, the difference between that sort of thing when it's unstripped because there's no fiber, and that's why when you eat an apple, there's the skin. It provides fiber and it causes a slower increase. Whereas you eat apple pie, uh,
Apples versus apple pie.
That's right.
So one more clarifying question, because you mentioned preservatives. A lot of times people think that diabetes just has to do with sweets.
Mhm.
And there are other foods that people eat. You know, you mentioned the high fructose corn syrup. A
Mhm.
lot of people may not be aware, but high fructose corn syrup is in a lot of products. It's in a lot of the ketchups. It's in a lot of the sauces.
Yep.
I've seen it in juices or
Yep.
juice drinks.
Yep.
It's also in a lot of the foods,
Hidden
like the
sugar.
people eat hot dogs
That's right.
and sausages.
Right.
And so I think that we have to understand that it's more than the fruits and vegetables and the candies and the desserts, but also be aware that those products and those ingredients are in a lot of the things that you would normally expect to see
Exactly.
them in.
Exactly. And you talking about hot dogs, I'll just make this quick comment is that, one of the biggest sources of a lot of these things, not just diabetes, but also in any type of, condition is
Hmm.
inflammation. And
Yeah.
these types of foods causes serious issues, particularly because when they're highly processed, your body has to go through, a multiplicity of ways to break it down, and that
Mm.
stresses your system. So and that's where a lot of people are having problems because they say, "Well, I don't eat a lot of sweets," but you eat a lot of high processed food. You eat a lot of hot dogs, a lot of sausages, a lot of a lot of breads that aren't as facilitated as some of the other types of breads, the different types of breads that you can eat. I'm saying the foods that you eat directly contribute to the amount of inflammation that's produced in your system, and that really
Hmm.
has a huge impact, not only just in facilitating some of these other chronic diseases, but also cardiovascular. It has really strong cardiovascular components to it, and that's kind of a big deal. The vascular impact of all of this.
Absolutely. Now, I am so happy that we are extending this conversation, because a lot of people need this awareness, and this is a great place for people to come, ask their questions, drop their questions in the chat so we can pull them up during our Q&A session with the audience. But I also want to talk a little bit about your credibility, because you were personally called by the president-elect of the American Diabetes Association after you applied for a board role, and he told you that your information was valuable,
Mhm.
but they really wanted you to have some local advocacy experience.
Right.
Now, what did you do with that feedback?
Well, basically, I thought it was great feedback. One of the things that I did do was again, reached out to some of the international organizations and tried to just incorporate and get a better understanding of the various local advocacy groups that are around. That there is one called TD1 Michigan, where they're type 1 diabetes, where they advocate for those that are dealing with type 1 diabetes here in the state of
Mm-hmm.
Michigan,
Mm-hmm.
where I live. And then you have regional groups as well, and as well as some of the other national groups besides the American Diabetes Association. There's a lot of small startup companies. There's a lot of different organizations that are out there that are supporting diabetes in general. So just touching bases, just offering expertise, guidance, also sharing my lived experience. There's you can be theoretical all you want. You can read a ton of books all you want, but
Right.
there's something about living with it that takes it to a whole nother level.
Mm-hmm. Mm-hmm.
And that's what I also try to offer individuals, is that I'm not just speaking from a theoretical standpoint. This is shared, this is life experience. This is what I've dealt with. This is what I've observed. Speaking with others that are having the same condition. My brother also is type 1 diabetes. And it's interesting that no two individuals are the same, and that's what people have to understand, is that even though it may be textbook presentation,
Mm-hmm.
the
Mm-hmm.
fact of the matter is how you handle low blood sugar is different from how someone else may handle low blood sugar. So there's different categories. So you have this big list. I only have this and that. Well, they only have this and that, and that's just the way it works. And so it's everybody is so varied. It's very variable.
Yeah, I understand that, because even in my own family, I have people who have diabetes. And so I love that you're letting people know that there are differences in presentation.
That's right.
And I love that you also took that feedback and did something with it. Sometimes we give feedback and we get stressed out, right? That's another part. We're talking about men's mental health, and we're like, oh no, feedback. But feedback can really help you to grow when
Right.
you take that feedback and apply it. So I love that you did that, because you also have a corporate wellness program. And I know that you target lawyers, you target financial professionals.
Yes.
What is the law firm or the finance team? What do they look like when that chronic stress has been running the culture for years?
I think what you begin to see is the falling off of availability, the falling
Mm-hmm.
off of productivity. You start seeing more absenteeism. The fact of the matter is that everything you're making money, things are going well. Everything's going at a wonderful clip, but then you start to get that little hiccup. Turnover starts to increase. Absenteeism starts to increase. Now, more and more people are even having chronic or maybe acute incidents while on the job or maybe
Mm.
at home. Somebody's kills over with a heart attack, or they may have presentations where we call it a left main stem disease, which is basically we call it widowmakers. That's it. And that's
Mm-hmm.
because
Mm-hmm.
many times, if you have this particular blockage, that can cause your significant other to be a widow. And so
Oh wow.
so we try. Yeah, it's a lot of times that's one of it gets caked up in the left anterior descending vessel, and a lot of that's from years of inflammation,
Mm.
years of stress, years of again, stress doesn't appear on your on your death certificate, but the effects of stress is what destroy
Mm.
MI. All of these things are what's impacted. But stress is we call it the trigger, the accelerator. It opens the doors for all of these things to be manifested.
Absolutely. And I'm so glad that you mentioned all of those points, because you not only target the lawyers and the financial professionals, you also target people who are burning both ends of the candle. And sometimes we're doing that and we don't even realize it.
Right.
I was reading this book and it said, oh, if you want to be a millionaire, you only need 4 hours of sleep, or you only need 2 hours of sleep, or your sleep should be earned. And so I love that we're having this conversation
Yes.
about the importance of rest and resiliency and really taking care of your body.
That's right.
Because when you're burning the candle at both ends without realizing it, you're creating physical stress,
Right.
emotional stress,
Right.
and then, like you said, in terms of the widowmakers, putting yourself in a position where your significant other may be left without a spouse, where your
Absolutely.
children may be left without a parent, where your friends are left friendless. And so
They'll be enjoying the fruits of your labor.
that's right. If you set your things up properly. That's why conversations with me are important on the
That's right.
financial spectrum. But
Right.
let's go back and talk about the warning signs
Yes.
that high stress professionals ignore. What do people ignore the longest before their body really just kind of forces them to stop?
I think sometimes we have frequent headaches.
Mm.
We increase irritability. Sleeplessness, it becomes a challenge when you have difficulty resting. Your mind's constantly racing, and then over time you start having the physiological effects. Where people start having their blood pressure starts to increase. And when your blood pressure starts to increase, sometimes you have headaches. Sometimes you can get weak. Have dizziness, dizzy spells. There's a lot of little things that you blow off as you just kind of, oh, let me just get some rest. Let me just sit down here for a minute, and then you get right back at it. But these are all signs that you're taxing your system.
Mm.
And if you don't start exhibiting direct manifestations of symptoms, meaning that you start getting chest pain, you start getting headaches that are beyond the scope of a migraine, or just extremely excruciating, where now you're forced to modify your behavior because you can't, I can't continue to compensate. Now I have to go to the doctor, and that's what I want to encourage everybody is don't self treat or self medicate. If you're having problems, get it checked out. Don't don't
Mm-hmm.
don't wait until you in an acute situation where now intervention is necessary, and now you laid up on your bed, your back, because you brushed off sign after sign after sign after sign of things that were manifesting. Your body will let you know. There are only a few conditions where you may not know what's going on, but even
Mm-hmm.
in those situations, there is still some little subtle things that you better than anybody. When something's off, you know that. You
Yeah.
know there's something that most people blow through it because they're like they're in the mindset that I can't stop. I got to keep doing what I'm doing. I can't break stride because you have that tunnel vision, but you still know when something is not off. You know that no doctor can tell you that there's something subtly going on. You tell them because you know better than anybody.
And I love that you tell them. And I like that you mentioned what to be aware of because sometimes people get headaches or chest pains and they just kind of brush it off like this is for the moment. But regular health care is extremely, extremely important. And those regular checkups matter. Now, I know usually they talk about your annual physical,
Mhm.
but if you need to go to the doctor more than once a year, I think people should absolutely go to the doctor more than once a year or when you
Absolutely.
feel like something is wrong as opposed
Okay.
to trying to self-diagnose. So thank you so much for
Well,
saying
that's
that.
critical, and this is men's health. Men are notorious for blowing it off. As you look at pushing through as a badge of honor, but unfortunately for men, pushing through is setting you up for a serious setback. If you want to be on top of your game, if you want to be there for your children, if you want to be there walking your daughter down the aisle or out at the games, watching your son or just spending time with your wife, you have to take care of you because you don't want to become a burden. You don't want your blessing to become your curse. And so
Mhm.
take care of yourself. If it's not right, there's nothing unmasculine about going to the doctor and say, hey, I'm not feeling good. I'm having pain shooting up my left arm, and I'm having chest pain after exercise, or if I'm running and I have to sit down and catch my breath. Don't do that because there's nothing that you could do if you're sitting up there in the ER or some major having some major either stroke or MI. Now you're left with your caregivers to truly become your caregivers. The very people
Mhm.
that you pushed aside because you're like, I don't have time. I got to do what I got to do. They're going to be ones that's going to be taking care of you when you can't really take care of yourself.
And I love that you brought that up. So I'm going to cheat, audience, just for a few minutes because I am the mother of a 16-year-old son. And so I'm going to ask a question about me. And hopefully I'm asking it now because it can help somebody else. What are the conversations that we should start having with our young men, with even younger than 16? Are there conversations that we should be having about young men so that by the time they become adults, that stigma just doesn't sit with them, that men don't go to the doctor, you're not supposed to cry, all of these things that affect men's mental health?
Right.
What are some things that we should be saying or that I should be saying to my
Well,
son about health?
I'm going to tell you. I know that the American Academy of Society. I know that many of the pediatric societies now are pushing new algorithms for young people. Where we've noticed that there's been a lot of in the news lately. I say within the last 10, 15 years of young people that are having major cardiac events.
Yeah.
And, that's because they never really, because of their youth, they didn't feel the need to put them
Mm-hmm.
through a lot of testing. It's just now that's kind of they're making it a requirement to run some simple heart tests to make sure that their hearts are there's no underlying birth related issues that they may be dealing with,
Mm-hmm.
that sort of thing. And I think that's really important. I think the biggest thing is to tell your child that if you notice something that's weird or different or let somebody know something. Don't
Mm-hmm.
just blow it off because I'd rather be told it's nothing than for them to say I wish you come here 6 months ago or a year ago, that sort of thing. The fact of the matter is just I think you want to educate them to pay attention to their bodies
Mm-hmm. Mm-hmm.
because like I said before, you're the only one that know. Nobody can tell you better than you that something's going on with you. And if you want to, and as you get older, you don't have to be now. We're having people presenting with with various cardiovascular diseases at 20, 25, 28,
Mm-hmm.
30. I mean, it's like the presentations that we thought back in the day in the 50s, 60s, and 70s. are now showing up in the 20s, 30s, and 40s. And a lot of that's because of our lifestyle, a lot of that's because of our diet, and a lot of that's because of the overconsumption of processed foods and some other things here in this country. So those are things that you make them aware of.
And I appreciate that. Thank you. I'm definitely, my son is one who taps in and he's like, Mom, this is the situation. And I'll take him to the doctor. So I love that conversation. And I
Absolutely.
appreciate you sharing some things that I can talk with him about before things run amok. And speaking of family, I know that you run your business with a family based team.
Mm-hmm.
That includes your nieces. So,
Mm-hmm.
what's building a business with people that you love? What has that taught you about, sustainable performance and also stress and health? How are those things
I think
connected?
it's very connected. For first of all, what I've noticed is that they are becoming a little bit more aware of their own personal situations.
Mm-hmm.
They're taking. I don't want to share too much about one of my
Right.
neighbors. They were having some challenges, but the fact of the matter is, they were having some physical challenges, and they
Mm-hmm.
contacted me and said, "Hey, this is what's going on with this, and you can help them out with that." But what I like about working with family is there's already a level of trust. There's already a level of familiarity. So many times you've heard of people building enterprises, businesses, whatever, and they get taken into the cleaners, or they didn't, read all the fine print, that sort of thing. When you build, you can grow together, and everyone, when you grow together, there's a certain level of comfort. There's a certain level of stability there when you all are in support of one another, and then you want to grow this thing together. And that's something that really meant a lot to me. Is that I'm not of the adage of I want to get mine and then go over there and then leave everybody else to what they're doing. But I want us to be an example, not only to our family, but also our extended family. Because a lot of our young people see what we're doing, and encourages them to apply themselves and go in a different direction. So it's like each one reach one type of mentality.
And I love, love, love that. I have to say, because a lot of times, just in terms of mental health for men and for women,
Mm-hmm.
a lot of times I'll hear people say, "Oh, I'm starting a business," but they have this mindset, because again, it's all over social media, that their family is not going to support them, that
Right.
they can't work with their family. And
Or they
so I
take
love
advantage of them or something like
right,
that. It won't
that
work
they're
with
going to
that.
do that. I love that you're working with your family. I love that you are working with your nieces. We're busting some myths today. But in terms of working with families, to work with your nieces, you left your career. So you had access to people like Ben Carson before his
Mhm,
political career,
mhm,
other colleagues who are at the highest level
mhm,
of cardiovascular
mhm,
medicine. So now you're an entrepreneur. So what does that version of you know now? What have you learned that the corporate world would not have been able to teach you?
I think I learned in the corporate world, again, the focus.
Mm-hmm.
I learned that the corporate world is that the bottom line is the product. However which way they get there, that's the bottom line.
Mm-hmm.
And you are collateral damage. It's all about meeting the end game, the end goal, and that's what I try to help. When I think about my colleagues that are still, working within the corporate structure, help them
Mm-hmm.
understand. Listen, you still have to maintain who your individuality. You
Mm-hmm.
still have
Mm-hmm.
to make sure that if you're going to do these things, you got to make sure that you operate at peak efficiency. If you're sick, take time off. If they give you
Mm-hmm.
time, take the time. You take breaks, go on vacations. Try to maintain. That work-life balance where you're not where every ounce of your being is being squeezed out. And I
Mm-hmm.
think that's something that's really stood out for me, is because when you're in the system, you don't see it because that's what
Yeah.
you're used to. Because everybody else is doing the same thing. But when you step out of it, then you're looking around and you're like, wow, I didn't realize, I remember those times, working late into the night and then getting the first thing up in the morning and or doing stuff on the weekend or particular, like for me, it was a Sunday. I didn't do anything, but even with that, I mean, I just helping them to understand that you can't keep this up indefinitely. That that that
Yeah.
that you have to step out, and you have to take some time and refresh yourself. When you go on a trip, you stop off at the rest area. You take breaks. You have to take breaks.
Mm-hmm. Because you said before, Mark, that people think of wellness as something you do when something is wrong. And I love that you're trying to reposition it as something you do to prevent wrong from happening in the first
Exactly.
place.
Exactly.
So, what's the resistance that you run into most when you kind of share that idea with organizations?
Lack of perspective. Again, because some may look at integrating things, for the employees to kind of enhance their wellness, so to speak, wellness space. They view that as, well, maybe, that will affect their output. That'll be a distraction. That'll be, instead of understanding that, no, that's a fundamental premise. If you want them to be healthy and you want them to be available, the best productivity is availability. Period. And wellness, if their wellness is going off the tracks, I mean, you may not be fully aware, but you will be aware in the back end of this thing when all of a sudden their call in rates are higher, or if they do start working. A lot of people, I think, one of the biggest challenges I used to talk to a couple of my colleagues when I was still in corporate was, you work sick, you come in, you know you're not well, but you're afraid to, you got to still keep pushing. I said, who does that help? You know, you, you, okay, you get this, you may accomplish this goal, and you may meet that deadline, but what does that do for you when you start having really serious repercussions from this sort of thing? So I just try to help people kind of take more of a time out, and I have to put different scenarios in there, because a lot of times when you're in it, you don't see the applicability of, oh, well, that doesn't impact me. I said, no, because you were in an environment that you're being preconditioned that this is not a big deal. But then when
Right.
you go down, or either when your body pushes back, or something happens, then your perspective again changes, and then you begin, it's like, wow, how can I be? I didn't realize I had drifted this far. It's all about
Absolutely.
perspective.
Yeah, and I remember my first year as a public school teacher. Now,
Mhm.
mind you, I was a public school teacher for about 20 years, but that very first year, my body started doing things that the body does, and I ended up being
Mhm.
hospitalized. And I remember my principal called me at the hospital and asked me about my lesson plans.
Mhm.
And so sometimes these companies will push and push and push, and you have to take that time to take care of yourself,
Absolutely.
regardless of what may be going on at the job. Because I know that had I passed away, they would have just hired another teacher and
Right.
maybe not send some flowers right to my
Right.
family. And
That's true. No, I'm sorry. Yeah, but I just totally agree with you. That's what I tell people. I said, who is missing you the most?
mhm,
Is the empty table? Is the empty chair at your family table, or is the empty desk at your corporation? Who's suffering the greatest loss?
yeah,
Because last I checked, like you said, if I fall over with a heart attack today, that job is being posted within a week or 2 weeks, and they getting somebody else. Where that that table setting is going to be sitting there a long time, where people are reflecting on the entity of you that is no longer present. So about
absolutely.
thinking.
Yep, definitely something to think about. So at this time, I'm going to do something new. It's called Carrie Connects Audience. I'm still playing around with the name, y'all. Drop some ideas in the comments section. But this is the Q&A section for all of the amazing people who have been in the audience. So pardon me for looking off to the side, but I'm going to go back and I'm going to just post some of the questions that the audience has had. We still have just amazing people who are still here with us. And so the first question is from Simone, which I absolutely love. How do you encourage men to seek mental health care?
I think for them, I think the biggest thing for them is to associate with other men. Many times, you're not an island. No man is an island. Usually, and if you're dealing with something, somebody else is dealing with the same thing. We just don't connect in our regard, in that regards. So, but I would encourage them to, first of all, just start being part of groups, hanging out with your guys. Just go out. Guys like to play basketball. They go watch sports. They go to a car show. I'm just saying, do things outside of your norm. and outside of your home, outside of your, where you guys get together with other men, and build camaraderie and that sort of thing. That helps your mental health, because eventually, as you guys start building, stronger relationships, or just hooking up with your boys, if you start building more relationships, then you guys start talking in among themselves, and then somebody might be able to give you insight that you might not have went and seeked. I might not go to a therapist, but I'm talking to my boy. He knows a little bit about or he's had somebody who's dealt with this sort of thing, and that opens us up, because a lot of times we have a tendency to be, closed. We don't talk about stuff. But when we hang out with like minds, then we're a little bit more open and willing to seek help, or we might find out some things that we can help them to kind of mitigate this thing on our own.
I love that. Thank you for answering that question. And Christy wants to know, how does exercise help to balance homeostasis?
Yeah, the body is a total system, from the head to the toe, the mind, body, and your soul. All those are interconnected. When your mind is off kilter, that impacts your body. When body's off kilter, that impacts your mind. And so, it's like a homogeneous, finely tuned machine. When things are out of whack, your engine, something's not right going on with the engine. The engine light comes on. And same thing with your fuel. If you start getting low on fuel, your fuel light will come on. It's time to fill this thing back up again. So exercise is critically important, because the cardiovascular system allows blood to go to every aspect of your body. And it's important for you when you're out there exercising. There's so many different things. It helps with blood sugar, it helps with digestion, it helps with sleep, because even going out and exercise, walking and exercise, all that helps you sleep better, even if you aren't sleeping that well. So it's a total comprehensive act of I call it resetting and amplifying what's necessary for you to continue to function at a high level.
I love that answer. Thank you for answering that question. Now, Layla wants to know, what can you do when you're experiencing insulin resistance?
The biggest thing for insulin resistance is exercise. So if you are, for example, if you eat, your insulin or your glucose is increasing, that's one of the most effective means of reducing your insulin resistance is by physical exercise. Go for a walk around the neighborhood, get on a treadmill, but just movement in and of itself will have a dramatic drop in your blood sugars. And that's the best way to do it. And that's what a lot of people don't do, because normally a lot of times you get sleepy. And so the exact opposite though is to take a nap, which is, that can cause, fluctuations. But I would say the biggest benefit is movement and exercise.
Appreciate that answer. And I'm laughing because I said, oh, he on here telling my business. Wait a minute. I thought I was interviewing you. Don't tell my business now, right? Love a good nap. All right. So let's go to the next question from Nicole. She wants to know, do you think it's okay for people who have jobs with no PTO, no health benefits, to ask for mental health time off? Because a lot of people don't have either one.
If it's within the bylaws of the company that you're working with? Absolutely. You can't, no man, again, you can't operate continuously. Nothing can. There's no car that can run. There's nothing that can work without having a break, a restoration. It's interesting. The one piece of equipment that I can think of that operates best when it's being utilized are cars and airplanes. You notice how they're flying back and forth. They're flying back and forth, flying back and forth. But even those, they have to run, take them out of circulation and put it through a battery of tests to make sure everything is going according to plan. We cannot operate continuously. We just can't do it. And if we try, that's going to increase the incidence of acute incidents of occurring. Or if it's long-term, the people that work continuously eventually heighten their level of stress, and then they start increasing. You start having this chronic stress syndrome that's going on, and that's going to have negative effects, particularly on your cardiovascular system. And when I say your cardiovascular system, I'm talking about the head, stroke, We talk about the heart attacks, or down, even your lower limbs, peripheral arterial disease. All these are interconnected by the cardiovascular system, and they all can be directly impacted by chronic stress.
Okay, now do that one more time because a lot of times people think, I know me personally, when I think stroke and heart attack, I always think here. But you just said stroke and you pointed to the head.
That's
So
right.
can you walk through that again? You said stroke, heart attack,
But
the lower limbs.
the calls, with exception, I don't want to get the heart attacks. There's two types of, when you think about the most common forms,
Right.
not the
Mm-hmm.
common
Mm-hmm.
forms. You have a heart attack, and then you have a myocardial infarction. Myocardial
Mm.
infarction is the most common type of heart issues. That basically is the blockages of the arteries. Basically over inflammation, and causes a mild inflammatory response within the vessels. Within the inner lining of your vessels, and that causes the body to react, and they start having the buildup of plaque and other gunk that starts to materialize within your vessels.
Mm-hmm.
Okay, that's MI, and that also can occur in the heart, that where you start having heart vessels that are plugged up. That can
Mm.
also occur in the head, where you have carotid artery build up, and where stuff start happening up in the head, and that's where a lot of strokes, we call them ischemic strokes, are the
Mm.
result of blockages. So a myocardial infarction is an ischemic event that happens in the heart. A stroke, it can be caused by an ischemic event where you have a lack of blood flow because of the blockages, and then that's what causes problems in the brain. Now they have other injuries as well that can cause a stroke, like which is also something that's still contributed by the same situation, because
Mm-hmm.
another type of stroke is hemorrhagic, meaning that the vessels may become weak over time and bust and blow, and those are really really serious types of strokes as well. But the thing is that on both of these etiologies, it still could be potentiated by poor diet, by lack of exercise, by just eating. The inflammatory process can, because if it weakens your vessels and you start having increased blood pressure, weakened vessels, increased blood pressure causes problems. If you can imagine,
Mm.
how that is, as the caliper of the vessels gets smaller, or the wall is very weak, then the various things can cause problems as a result of that. So yes, the head, the heart, or the legs, all these things are interconnected.
Wow, that's just so profound. And I encourage people, you all connect with Mark on LinkedIn. Mark Brezzell is on LinkedIn. I have that on the screen. It's also on all the platforms in the comment section. And then you can also connect with him on Linktree. And that way you can find all the other places that you are able to connect with him as well. So it's at linktr.ee, and that's MDB Live Connects, spelled with an XT LLC. But you all make sure that you connect with him to continue this conversation and find out what are some things that you can do to make sure that you are healthy during men's health, to make sure that the men in your life are healthy. You want to continue to have these conversations. So, Mark, what does the next chapter of your platform look like as we wrap up? What are you specifically trying to do, like in the next 90 days? Any type of professionals that you're trying to connect with?
Right now, my focus again is building again around the legal and even financial, but the doors are opening. My real focus is anybody that has a high stress life, a high
Mm,
stress job,
mm-hmm,
anyone,
mm-hmm.
because we undermine and we underestimate the impact of chronic stress. It's something that we live with, something that we accept, something we feel is a part of normal. And like you said at the beginning, we normalize
Mm-hmm.
abnormal behavior and
Yeah.
abnormal situations. And so that's what I help people to understand. And I started getting to even other areas, because I was even told, why don't you talk to doctors? I mean, why don't you talk to nurses? Why don't you talk to the very people that take care of people? Because they are under a great deal of stress as well, which I was.
Mm-hmm.
I spent years in surgery. It was very, very, very stressful. So that's another chapter that I'm started looking into, is reaching out to my own medical colleagues and say, hey, you know the pathophysiology, but a lot of times it's not the pathophysiology that's the problem. It's the mentality and
Mm.
focus.
And I agree with that as we talk about mental health, mental wellness, because even in multiple spectrums, you'll see that you have to start with mindset. And so having this conversation has really been profound. Again, you all connect with Mark. And if you're looking for an opportunity to be a guest on a podcast, make sure that you DM me about being a guest on Carrie Connects. We're at Great Finances on all platforms. So closing question, is there anything that our audience can do this week, before this week is over? Any last words of encouragement as we wrap up? I'm going to give you the final word.
I give you 3 points that you can do. One is try to get more sleep. Go to bed an extra hour early, or sleep in an extra hour later. But try to see if you can get a little bit more sleep, and see if you can get more refreshed. And maybe something to help facilitate sleep. Go for a walk. You don't need the health club, membership. You don't need. Just go for a walk around your neighborhood. Go for a walk even in your home. Go up and down the steps a few times. But I'm just saying, try some movement. Try, try to get more rest. And then I say also hydration. Drink. Try to drink more water. Try to drink 8 glasses of water if you can, or just take a water bottle and just sip on it all day long. You don't have to guzzle it down. It works better over time by just sipping on it throughout the day. And those 3 things in and of itself, you'll start noticing a profound change, just even how you feel.
Absolutely love that. So thank you again so much for being here. Please connect with our audience and respond to their questions and comments in the comment section. We have people on LinkedIn. We have some people on YouTube. We have people on Facebook. So I just appreciate you being here on Carrie Connects. And thank you all for being here. Thank you so much for being in the audience. Thank you again for coming back to be a guest on Carrie Connects. We'll see you next Saturday, 2 p.m. Central Standard Time, 3 p.m. Eastern, and that is 12 p.m. Pacific Standard Time. Thank you all. Have an amazing Saturday. Bye for now.
Hey, welcome in. Let the good vibes all begin. Something good is about to happen. Sure. I've been waiting on you. Got a seat with your name. Started with a coffee chat. Now we about to change the game. You got a story worth telling, and I got a room full of ears. So drop whatever you've been holding, get ready because your time is here. Because when real people talk to real people, something shifts. When real stories meet real listeners, something lifts. Every Saturday we show up and we bring our best. Show up to Carrie Connects and leave it there. Show up, show up. Something is happening here. Carrie Connects, Carrie Connects. This is your moment, come near where every story intersects and every heart connects. From a coffee chat to the main stage, just bring who you are. Carrie Connects, Carrie Connects. Connection is the start. Carrie Connects. Entrepreneurs, voices, friends, where inspiration never ends. You did not come this far just to sit in the back. Everything you walk through was getting you ready for that. So step into the light. Let somebody see your face, because the right conversation can change everything in this place. When real people talk to real people, something shifts. And real stories meet real listeners, something lifts. Every Saturday we show